Welcome back, ladies and gentlemen, to the YouTube channel Doctor's Wisdom Share. Today, I would like to share with you a discussion about calcium deficiency. Now let me ask you this, are you personally deficient in calcium? Are your family members deficient in calcium? Or do you believe that you might already be consuming too much calcium? My generation was a generation that grew up in poverty. Because we were poor, we lacked almost everything. And because we lacked everything, an entire generation ended up being physically underdeveloped. The average height of people from my generation did not even exceed the height of a 5-seat passenger car. This is something that is truly painful to acknowledge. However, every single day, when I commute to work by bus, I observe university students, and very often I see that they are even shorter than people from my generation. These are young people who are at the age of growth, the age of development, the age of university students and age, when they should naturally be growing taller. Yet, instead, what I see on the bus are almost entirely students with stunted growth. This is something that we really need to stop and think about seriously. I want to say this clearly, in our nutrition, there are two fundamental issues. The first issue is that we eat in order to supply energy. The second issue is that we eat in order to supply micronutrients. In my generation, we were deficient in both energy and micronutrients. Today, people consume excess energy, which is why obesity and weight gain are everywhere. But at the same time, we are deficient in micronutrients. As a result, our bodies are constantly fatigued, and many different diseases gradually develop. And that brings me to today's topic, the topic I want to discuss, which is calcium deficiency. When we are deficient in calcium, I can say very clearly that this is an extremely dangerous condition. It causes more than 100 different diseases across 8 different organ systems of the human body, and among those diseases, there is even cancer. Therefore, from certain perspectives, we can say that calcium deficiency may actually be more dangerous than cancer, yet most people do not know this. I can state with certainty that a very large number of people are currently living in a state of calcium deficiency. So then the question becomes, at different stages of life, which age groups need calcium supplementation the most? Let us imagine it this way. From the moment we are in our mother's womb until the day we die, we must continuously supplement calcium every single day, and we must supplement enough. So which age group needs the most calcium? We know that pregnant and breastfeeding women are at the highest risk. During pregnancy, a woman is nourishing the fetus inside her body. Especially from the 6th month onward, the fetus gains weight very rapidly. During this period, calcium requirements increase significantly because the mother must supply calcium not only for herself, but also for the developing fetus. That is why calcium intake must be increased. Then, after the child is born, the mother breastfeeds. At that point, she is essentially nourishing to body her own body and the child's body. As a result, the demand for calcium becomes even greater. This explains why one of the most common diseases we encounter is osteoporosis. Osteoporosis is seen far more frequently in women, and women who suffer from osteoporosis experience devastating consequences. People often think cancer is dangerous, but in my opinion, osteoporosis is far more dangerous. I want to say something to my younger colleagues, especially those who read quartz scans. Osteoporosis does not require a special bone density machine to be diagnosed. Quartz scans can measure vertebral bone density very accurately. Under normal conditions, vertebral density should be above 150 Hounsfield units. However, I have measured women whose vertebral density was only 25, or even below 20 Hounsfield units. That represents extremely severe osteoporosis. These individuals are at high risk of femoral neck fractures, fractures in multiple locations, and vertebral collapse. The pain they experience is unimaginable, if worse than cancer pain, many times worse, reaching a truly horrific level. Fractures caused by osteoporosis are extremely dangerous. So when making a diagnosis, all you need to do is add one simple step: measure the density of vertebrae L1, L2, and L3. If the density is below 25 Hounsfield units, the condition is extremely severe and represents a life catastrophe for that person. From 25 to 50 Hounsfield units is very severe, from 50 to 75 is severe, and from 75 to 100 indicates significant calcium deficiency. Values above 150 are relatively safer. We know that before the age of 20, the body absorbs calcium very efficiently. But from the age of 20 onward, if calcium intake is insufficient, the body loses about 1% of bone calcium each year. That means from age 20 to 30, by the time we reach 30, we have already lost 10% of the calcium in our bones. Losing 10% of bone calcium is already an early and very dangerous sign of osteoporosis. From age 30 to age 50, and specifically by age 50, the body may have lost around 30% of its bone calcium. Just imagine fat bones losing 30% of their calcium. That number is truly terrifying. At that point, you will immediately recognize the symptoms. At night, you experience muscle cramps. At night, you feel numbness in your hands and feet. At night, you cannot sleep deeply and experience vivid dreams. You feel restless, irritated, unable to sleep. During the day, when you wake up and go to work, you begin to feel neck and shoulder pain, shoulder joint pain, knee pain. And all day long, you feel sleepy, yet you cannot actually sleep. In short, there are so many symptoms. I have seen countless patients who go from one hospital to another, from this hospital to that hospital, without finding any clear diagnosis. They complain of body pain, joint pain, poor appetite, and many other vague symptoms. In my experience, the majority of these illnesses are caused by calcium deficiency. As I mentioned earlier, calcium deficiency can cause more than 100 different diseases. I want to emphasize once again that this is especially dangerous for elderly people. By the age of 70, according to this calculation, approximately 50% of bone calcium has already been lost. Losing 50% of bone calcium places a person in an extremely dangerous condition. Calcium deficiency affects people of all ages from unborn babies in the womb, through adulthood, and into the final years of life. That is why adequate calcium supplementation is necessary throughout the entire lifespan. In Eastern culture, there is a belief about recurring misfortunes that people experience, known as tamtai. Certain age ranges are believed to bring greater adversity. Many people may understand this concept better than I do, but the concept of tamtai is closely related to calcium deficiency. According to Eastern astrology, tamtai refers to 3 consecutive years of misfortune, with the third year being the most severe. These periods often occur around ages 30, 31, and 32, and again around ages 47, 48, and 49. This explanation comes from Eastern philosophy and traditional metaphysical beliefs. However, when we look at this from a scientific and health perspective, the pattern is strikingly similar. At age 30, the body has already lost about 10% of its calcium. That 10% marks a clear turning point in health. Between ages 30 and 33, people experience noticeable changes in their physical and mental condition. When calcium is deficient, brain function declines, concentration decreases, and people become more prone to accidents, illnesses, and misfortunes, what people traditionally refer to as tamtai. By age 49 or 50, calcium loss reaches approximately 30%. That is an enormous loss. When 30% of bone calcium has been depleted, the body becomes extremely sluggish and weak. At that stage, people struggle to function normally. That is why I advise people to pursue major life goals and start businesses before the age of 30. After 30, it becomes more difficult, and after 50, it becomes extremely difficult because thinking slows down and physical energy declines. If we want to overcome these difficult periods, we must ensure adequate calcium intake through diet and, if necessary, through supplements so that we do not fall into the condition I have described. So the question is, how do we supplement calcium correctly, and what mistakes do we commonly make? We always think that we consume enough calcium, but the reality is not like that. I have a neighbor who suffered from neck and shoulder pain that gradually progressed to severe shoulder joint pain. He visited major hospitals and consulted senior professors for 2 or 3 years, yet his condition continued to worsen until he could barely move his shoulder. Eventually, he called me and said, "Doctor, I know you're very busy, so I didn't want to bother you, but I have no other choice because my shoulder pain has become unbearable. I've had MRIs, I've seen specialists, but nothing has helped." After listening to his symptoms and reviewing his MRI, I told him the cause was simple: calcium deficiency. He insisted that he ate very well and could not possibly be deficient. So I asked him, and I ask all of you watching this question. To meet daily calcium requirements through diet alone, you would need to drink about 350 milliliters of milk, eat half a kilogram of dark green leafy vegetables, 1 egg, 300 to 400 grams of meat, more than 3 bowls of rice, plus additional fruits and foods every single day. Can most people realistically eat like that? For most people with busy schedules and sedentary lifestyles, this is extremely difficult. Many women also deliberately restrict their food intake to lose weight, making adequate calcium intake even more unrealistic. Even if someone managed to eat like this, within 1 month they would see their weight increase dramatically. That means relying on diet alone is not feasible. That is why I explained to my neighbor that no matter how he ate, his diet was still deficient in calcium. In fact, global calcium deficiency maps published since 2017 based on rigorous scientific research show that many people consume only about 345 milligrams of calcium per day, while the body requires 1,000 to 1,200 milligrams. That means we are consuming only slightly more than 1/4 of what we need. So yes, diet is important, but it is not enough. Based on my observations, around 80% of people who repeatedly visit hospitals suffer from diseases caused by calcium deficiency. Because diet alone is insufficient, supplementation becomes necessary. But before we talk about how to supplement correctly, we must first understand how calcium deficiency works inside the body. The human body contains approximately 75 trillion cells. For the body to function properly, all of these cells must work. Brain cells allow us to think. Pancreatic cells produce digestive enzymes. Kidney cells perform filtration. If cells lack nutrients, their function declines and disease develops. Cells require transporters to bring nutrients, insulin delivery drivers. Calcium is the most powerful transporter among minerals. Without enough calcium, cells remain chronically undernourished and dysfunctional, leading to widespread disease. The rest of the explanation continues logically from this mechanism. Let us imagine it like this. Normally, how many cells are there in the human body? There are approximately 75 trillion cells. These cells must function properly for the body to carry out all its different activities. For example, brain cells must function so that we can think. Pancreatic cells must function so that digestive enzymes can be produced. Kidney cells must function so that filtration can take place. Now, if those cells do not have enough nutrients to function, their activity will decrease, wouldn't you agree? And when their activity decreases, disease develops. It is actually that simple. So in order for cells to have enough nutrients to function, there must be transport substances. You can think of these transporters like ride-hailing drivers, delivery drivers, or crews that transport nutrients into the cells. But for nutrients to enter the cell, there must be a carrier. What are these carriers? There are many different substances that act as carriers to bring nutrients into cells, but most of them have very limited transporting capacity. For example, sulfate ions can transport only about 2 units into the cell. Carbonate ions can transport about 3 units. Magnesium can transport up to 20 units, which is already much higher than the others. Potassium can reach about 70 units, which is quite high. But calcium, how much can calcium transport? Calcium can transport 10,000 units. That is a completely different scale, isn't it? So now, if we do not have enough calcium to transport nutrients into the cells, what happens? The cells will always remain in a state of nutrient deficiency. And when cells do not have enough nutrients, they cannot function properly. If brain cells cannot function, then as I mentioned earlier, people experience constant drowsiness and inability to think clearly, poor concentration. In children, this leads to poor learning ability and intellectual underdevelopment. In adults, it means an inability to think deeply, plan long-term, or develop broader vision in life. And from this single mechanism, many different diseases begin to develop. That is why I want to emphasize that calcium deficiency leads to a vast number of diseases, more than 100 diseases affecting 8 different organ systems of the body. So from our conversation so far, I want to ask you, can you think of any organ in your body that might be suffering from calcium deficiency? Let me give you an example. Let's talk about the eyes. When the retinal cells and epithelial cells of the eyes lack calcium, their function declines. And you will notice that after the age of 50, the age I mentioned earlier in relation to TAMT, vision begins to deteriorate. Vision becomes blurry. Some people have difficulty seeing distant objects, which we call farsightedness. Others have difficulty seeing near objects, which we call nearsightedness. Some develop astigmatism. These are all manifestations of eye damage related to calcium deficiency. But in summary, the first place where calcium imbalance shows up is actually in the blood vessels. When we do not consume enough calcium through our diet, absorption into the bloodstream becomes insufficient. And when blood calcium levels drop, the body must regulate itself. The body has a remarkable regulatory system. The level of calcium in the blood must always remain stable. If blood calcium drops to low or rises to high, the person enters an extremely dangerous condition. Seizures may occur, and death can follow. Therefore, blood calcium levels must always be tightly regulated. So how does the body regulate this? First, if we do not consume enough calcium and blood calcium levels drop, the parathyroid glands in the neck immediately secrete a hormone. This hormone enters the bones through the periosteum. It penetrates the long bones and reaches the bone marrow. Once inside the bone marrow, it dissolves the calcium stored there. That dissolved calcium, now in ionic form, is pulled into the bloodstream. And this is exactly why osteoporosis occurs. Now, when this process continues, when the parathyroid glands continuously secrete this hormone, demand increases over time. More and more calcium ions are pulled from the bones into the blood, raising blood calcium concentration. But high calcium levels in the blood also require regulation. So what happens next? First, calcium begins to deposit along the walls of blood vessels. This deposition causes atherosclerosis, increases blood pressure, and if it occurs in the coronary arteries, it leads to myocardial infarction. If it occurs in the blood vessels of the brain, it causes ischemic stroke. So the first site of damage is calcium deposition in blood vessel walls, which helps reduce blood calcium concentration, but causes severe vascular disease. Second, if vascular deposition is not sufficient, calcium is filtered through the kidneys and excreted in the urine. When large amounts of calcium are excreted, it combines with acids. For example, in people with gout, there is uric acid. Calcium combines with uric acid and forms kidney stones. In people who consume a lot of green vegetables, oxalic acid is present. Oxalic acid combines with calcium in the kidneys, forming kidney stones as well. This is why many people mistakenly believe that excess calcium causes kidney stones. In reality, calcium deficiency is the root cause. When calcium is pulled excessively from the bones into the bloodstream, it leads to kidney stone formation. There is yet another regulatory mechanism. The thyroid gland secretes a hormone called calcitonin. Calcitonin transports excess calcium from the blood back to the bones. However, this calcium cannot pass back through the periosteum to its original position inside the bone. Instead, it accumulates at the ends of bones, forming bone spurs. These bone spurs develop in joints, knee joints, shoulder joints, ankle joints, finger joints. They press into the synovial membrane and joint capsule, causing severe pain. So calcium deficiency leads to 3 major outcomes. Deposition in blood vessels, excretion through the kidneys causing kidney stones, and return to bones causing joint degeneration and bone spurs. But even these major problems are not as critical as damage at the cellular level. When cells lack nutrients and cannot function, the organ where those cells reside begins to fail. For example, in the cardiovascular system, when heart cells lack calcium, heart rhythm becomes irregular. Over time, this leads to serious heart disease, valvular stenosis or regurgitation of the mitral valve, tricuspid valve, pulmonary valve, aortic valve, and eventually heart failure. In the nervous system, when brain cells lack energy, people experience brain fog. Around 4 p.m., they feel overwhelmingly sleepy, yet when they lie down, they cannot sleep. Thinking becomes difficult, focus disappears. This includes damage to the autonomic nervous system. When the autonomic nervous system is affected, people experience palpitations, hot flashes, irritability, anxiety, symptoms resembling premenopause and menopause. In the digestive system, liver, gallbladder, pancreas, spleen, stomach, intestines, calcium deficiency causes severe consequences. Take the pancreas as an example. When calcium deposits in pancreatic capillaries, it can cause acute pancreatitis, which is extremely dangerous and carries a high mortality rate. When pancreatic cells are damaged, digestive enzymes are not produced, insulin secretion declines, and diabetes develops. Glucose cannot be metabolized properly, accumulates in the liver, and is converted into fat, leading to fatty liver disease and weight gain. People gain weight easily even when eating very little. And beyond all of this, there is cancer. Cancer occurs when the immune system weakens. When immune cells lack energy, they cannot function. The body constantly produces abnormal cells, like criminals in society. Normally, immune cells act like police officers, identifying and eliminating these abnormal cells. But when the immune system is weak, it cannot perform this role. Abnormal cells proliferate and eventually develop into cancer. This is how calcium deficiency contributes to cancer for immune system failure. So if we were to list all the diseases caused by calcium deficiency, there would be more than 100, with countless symptoms, driving people from hospital to hospital, month after month, without finding the true cause. However, calcium deficiency can be corrected if supplementation is done properly. Because diet alone is insufficient, supplementation becomes necessary. There are many calcium supplements on the market. Some are expensive, some are cheap. In my experience, expensive does not necessarily mean better. What matters most is how calcium is taken. Many people make mistakes, such as taking calcium and magnesium together, or taking calcium only in the morning. In reality, calcium deficiency not excess causes kidney stones. Bone calcium loss peaks around 3 am. That is why muscle cramps, numbness, bone pain, and restless sleep often occur at that time, especially in pregnant women. Therefore, taking calcium before bedtime is more important than taking it in the morning. Calcium should be taken in small, divided doses, spread evenly throughout the day. Calcium and magnesium should not be taken together. Calcium should be taken first, and magnesium at least 2 hours later. Calcium must dissolve in stomach acid to be absorbed. The best time to take it is 30 minutes after a meal, when stomach acid secretion is highest. It should be taken with a small amount of water, about 100 ml to allow proper dissolution. These may seem like small details, but small changes lead to big results. I hope that through this program, you gain scientific knowledge and develop healthy habits for proper calcium supplementation. Other micronutrients, such as magnesium and vitamin D3, will be discussed in future episodes. For now, goodbye, and I look forward to seeing you again in our upcoming programs.